Hi, this is Kyle again, and this is the infamous Dr. Wright, and I want to have an interview with him about CAPS and what it is, the services it offers for incoming freshman students and current students. So I want to introduce my good friend, Dr. Wright.
Thank you. I'm glad to be here, actually.
Glad to be here too.
Yeah, likewise.
So I want to talk to you today just about, CAPS and what's your role in CAPS. And first of all, what's CAPS stand for? Many students don't know what the acronyms stand for. You could talk more about that.
Yeah, Georgetown is a land of acronyms, and so CAPS stands for Counseling and Psychiatric Service.
Okay.
And so we use the more friendly sort of CAPS rather than the long phrase of that signifies CAPS.
Okay. So what's your role on campus, or what's your role in CAPS?
Yeah. Well, let me say this. So I actually have several roles itself.
Mm-hmm.
I actually have a dual appointment. My position is pretty unique. I'm a psychologist here. Wow. By training. But like with most of my colleagues, I'm a generalist. So in other words, I'm trained to kind of deal with multiple mental health, emotional issues that students may have. But at the same time, I also work over at CMEA.
Okay.
There's another acronym standing for the Center of Multicultural Equity and Access.
Okay.
And in both places, my primary responsibility is to allow for students to freely access me. So I primarily will do counseling and consultation. What I do know is this, while I'm very busy at CAPS, there are a number of students that either don't know of where I'm located or don't necessarily know that services are being offered here. So me being over at CMEA allows for other students that may not stumble upon or may even be reluctant to come to CAPS to at least see me in a different context here at the university itself.
Okay, wonderful. I know you mentioned, people can come in and see you. Now, are the services free for students, or what is there a charge to go, meet with a counselor like you or someone else, or how does that really work out?
Yeah, it depends on the service itself. Let me say this though, every initial contact is free. So when we're looking at intake, and generally an intake is a short interview, 5-10 minutes, where we're just trying to figure out sort of what's bringing the person in, and then deciding sort of where they should go or who they might speak to. That's free. Then if we think it's necessary, we'll do a longer evaluation. There what we're going to do is literally collect in-depth information about the specific issue, as well as personal questions that will give us an idea of who that person is and how we might best serve them. That's totally free. Now if the person decides that they actually want to do individual counseling or therapy, that in and of itself will be a fee. Now, that all depends on your financial resources. Most students will come in with insurance, and whatever their copay is, that will be what they'll pay for the individual sessions. So if you have the student insurance, the copay is going to be $10 a session. However, that being said, I know and we're aware of students that that may actually be a hardship or a limitation. And if it is, we will do everything possible to slide the fee or find an alternative way to pay.
Okay.